Hello guys, I know, long time no see. I didn't make videos for a while. We had like last month we had so many tests. I'd say like, I don't know, like 6 or 5, and then also, and they were all like in 1 week. And also besides that we had our board exam. Like some people took CDCA and I particularly took credits, and it was kind of very busy. In the meantime, we were in clinics, so we had patients every day, and we had to prepare for that, and it was just very busy. Anyway, I am back, and I made some video for you with the updates, how the clinics goes, and the main thing that I want to share in this video is that we were required to take some CE courses that will help us, I guess, in for educational purposes. But I think you can, guys, take the CE courses, and they might help you in your kind of upgrade your resume a little bit, especially if you don't have any CE courses in your resume. So I hope this video will be helpful. Anyway, I'll post all CE courses in the description of the video, and you're welcome to use them. And so far, they're like Oral-B and CREST. They have like different, basically they have like multiple CE courses. They're all free and they're all online, and they issue you a certificate after you done with them. So it's something that might help you. I know nowadays it's so hard to find something that is valuable and can be free and online, so that's why I'm sharing. And the other courses are from ColorMage. They're more from ShadeMage for the crown, which they give you a certificate as well. And we were required to take this course during our fixed prosthodontics course as a requirement. So I think this might be helpful to you. Obviously, don't treat CE courses like some panacea. It's not a panacea. You basically, it's like just a little piece that will add to your resume, but obviously it has to be nice as a whole. Anyway, about the clinics, how clinics is going so far. It goes well. We have patients, we have different kinds of patients, I'd say. So we start with the perio, and then we do operative, then we do fixed, and then partial or dentures or whatever patient needs. We have some root canals. I'd say it is busy. I also was on rotation in oral surgery. In oral surgery, mostly you get to extract teeth when you're in a 4th year student. So mainly in oral surgery in 3rd year I was assisting. I got to extract, I guess, 1 tooth, and I got to place some sutures, but just because I asked and I was assisting a resident, so he didn't mind. The interesting thing that I was told by them that lots of residents who are not from our school, they're sharing their kind of experience from their school. And they're saying that in comparison, we have pretty strong clinical experience in here. They're saying, some of them told me that, I'm not going to tell from what school they are, but they told me that they never set teeth themselves in their school. They always send it to the lab, which is, I think it's, you will not be doing that as a dentist when you work, but that's a skill that helps you to understand the occlusion, and it kind of, I don't know, I think it helps you to develop your knowledge, The other thing, he also told me that they didn't do that many extractions, and especially they didn't do any sutures in their school. So he said that in comparison, we are doing lots of extractions. As a D4 year, you get full mouth extractions, you extract a lot of teeth. And that's not something they've done in their school, which I was kind of glad to hear. So that's the experience we're getting here. And the other student told me that that was different. These residents are from different schools. The other students confirmed that to me, this information too, in comparison to her school, which I was pretty happy to hear. And also, I understood that they had a little bit less requirements for overall in clinics. which might be one of the reasons, because both these residents, they graduated during the COVID years, and when the COVID was, the requirements were way lower for graduation, like comps, than right now. So maybe that was part of the reason, I don't know, because obviously it was less patients during COVID, like patients would not go unless they have to, and it was like a different completely situation. That's my updates about clinics. What else? I'll tell you a little bit how it works. So clinics, we usually in the morning, this is like third year, so if you got accepted, so you will know what to expect. Usually you come in the morning from 8 to 9, you have a lecture, you have a class, could be lecture, could be exam on that class, right? And then you have clinics from 9 to 12, so you have a patient. Then from 12 to 1 you have a lunch. Then from 1 to 2 you have another class. And from 2 to 5 you have clinics again. So basically you have 2 patient sessions in a day, and you have 2 clinics. No, I meant you have 2 patient sessions, like 2 clinics, that's the same. And you have 2 lectures / exams, like sometimes in a day, which is nice. The other thing we have is we have rotations. So we have like external and internal rotations. I haven't been to external yet. I've been only to internal. Internal is usually oral surgery, and it's oral diagnosis, where treatment planning, where we have initial like patient comes, radiology rotation. What else? I don't know. That's the rotations I had so far. I've heard that on the 4th year you have external rotations, where you go to some clinics and you just basically treat patients like all day long, and you have like lots of patients, not like 2 sessions. You have like every hour patient comes, and you either do treatment or you perform extractions like all day long, and there is like way less hassle. Like when you are here on the floor in clinics, you need to get the swipes for everything. You like basically whenever you have a patient, you have to have a swipe from the faculty who covers you. And I've heard that in external rotations, I don't know, it's much more easier kind of, so it doesn't take so much swipes or whatever procedures we have. Like in computer wise, you don't do so many stuff on computer, which we do a lot here in the floor. Like before you can even look at the patient's mouse, you have to file like, I don't know how many forms, like at least sometimes 2 forms at least, and you have to stop in the business office and get faculty permission, which takes a lot of time. That's why usually we are able to see 1 patient per shift, like morning 1 patient, afternoon. If it would have been less of swipes and less of this like computer stuff, which some of them like is medical history update, which you have to do, that's kind of good thing to do. But some of that is just like, I don't know, insurance approval, or you have to stop with the business office and make sure like patient pays or something like that, and it all takes time. Also lots of time takes if you need to do x-ray, because sometimes it's a line in radiology, so you have to go and kind of half of your appointment you're just spending in radiology just to get this x-ray. But once everything is done, or if like you've done it on a previous appointment, then it's pretty straightforward. And I saw some students, like D4 students, I witnessed, they had like 2 patients a shift. So basically in a morning shift from 9 to 12, she was seeing 2 patients. So this is possible, but you need to plan everything wise in ahead, and then you'll be able maybe to have 2 patients a shift. But the most of the time it's like 1 patient in the morning, 1 patient afternoon. That's the schedule. I don't know how it is in other schools. Please let me know how it goes in other schools if you have some experience or you know someone like with this experience. Oops, my microphone fell. So I hope you enjoyed the video. Please let me know if you have any questions, and do the CE courses. They're free and they're online, so everyone can do them and get some points for your resume. So hopefully that will help you as well. Anyway, see you soon guys. Like my video if you like it. Bye.